Yeah, so we know that we need some very accurate tool to monitor disability in MS patients. At the early stage of the disease, we know that subtle changes in disability, what we call PIRA, can be very relevant to detect because it is a factor which can lead to a worse prognosis in the long term. And also for progressive MS patients, we need some accurate tools to monitor them, because EDSS, which is the most used scale at the moment in the real life, I'm not talking about clinical research setting, is a step-based scale, and for patients with values above 4, it only reflects ambulation but not all the other aspects of the disease. So there is a need to develop some additional tools to monitor disability, and we presented a work of a digital tool that could give a better insight into the patient's disability without any rating task for the clinician and with a more linear quantification of the disability. I think it's still a great challenge because there are some other tools that can be used, such as 9-hole peg test, patient-reported outcomes, and so on. But those tools are mainly restricted to tertiary care centers or in the setting of clinical research. It's difficult to use them in the routine use. And so what we wanted to do is to provide something that could be used by anyone and to get a better insight into the disease. Many people are worried about this, but I think it's not the case. We should consider AI and digital tools as helping tools and not threatening things that could just take the place of the clinician. And if you consider the tool we presented, the physical examination remains the core of the tool, but it's just the rating and the classification process we have to do when we rate EDSS that is just relieved because it's done automatically by the app. We still need to assess things like rater variability, things like sensitivity to change, because the study we presented was a cross-sectional study with one measure per patient, but we still need to know how sensitive it is to detect change in disability, and of course to comply to all regulations and so on. But I think these kind of tools could be quite easily adopted in the real life. Yeah, I think it's quite simple, because for the clinician, the only thing the clinician has to do is to describe the neurological examination on the app. So it's something we are very used to do every day. It's not something that you need to learn. So I guess it could be quite easy. So the main things is that we presented a tool that can bring some linear quantification of disability, which could be used in addition to EDSS without any rating task, so just describing the neurological examination. So it's quite simple, quite easy to access, because you just need a smartphone or a tablet to do it. So that's the main point. And the other point is that the app we presented also takes into consideration some symptoms, some invisible symptoms that are out of the scope of the EDSS, so it may give a more precise evaluation of the patient disability. If, just to take an example, among the patients who had an EDSS 0 in our study, only a few minority had a maximal score in our app, because most of them had some subjective complaints like fatigue or neuropathic pain. Even if it's not permanent, intermittent pain or intermittent fatigue that could impact their quality of life, but those symptoms are currently out of the scope of EDSS. So it's a way to get a more precise evaluation of disability without any effort by the clinician.